we are all part of an alliance of U.S.-based international organizations called InterAction. And InterAction has high standards for all of us. And what the American public would know about members of InterAction and all of the groups here take pride in their membership is that, one, we are really committed to accountable use of funds, with much of that going directly to people in need. Number two, we are all committed to working with local people, empowering local communities, working with local government. So the return on investment is stronger healthcare systems, stronger societies. And then number three, that we're all committed to work against the root causes and long-term development, upholding values that I think all of us embrace.
Ebola has taken such a hold that hospitals and clinics have shut down. Some of the schools are shutting down. And as a result of that, there are many primary health issues and secondary health issues that are untreated and unaddressed.
Some of the bigger impacts that we're beginning to see are the economic impacts on those societies. Unemployment has gone way up. You've seen markets shut down. You've seen goods that used to flow freely across those borders. These were regional economies. Those goods have not been able to flow. And now you have a looming concern over food security because of increased food prices and the fact that Ebola peaked right around the harvest season. So you weren't able to get the same quantities of food harvested and into local markets. So this, as has been said, this is going to be a long-term challenge. We can't just, as soon as the last infection, we can't say job done and walk away, because the impact on these societies are going to be felt for years to come.
At this point, we know that the impact is huge, but it's not even quantifiable yet. Not quantifiable yet in the short term or the long run, because there are so many other health issues, and people have no way to seek treatment because the facilities don't exist, or if they do exist, they're so afraid because of Ebola they're not seeking that kind of help.
We have seen some significant progress where, for example, in Lofa County, which is where this pandemic started, for the first time we are seeing a marked decrease in the number of incidences. We are seeing in areas where interventions have taken place a significant shift in this pandemic, which leads us to be optimistic.
Certain areas of Liberia, we've seen it leveling off, and we think overall that the rate of increase in Liberia is declining. That is, it's still increasing in Liberia, but the rate is declining, we think. In Sierra Leone, there is an increase in caseloads, and in Guinea as well. And so this is one of the main reasons that we're not out of the woods yet.
A startling statistic is that 85% of the people impacted have now cut back on their food consumption, partly because food's not as available in the markets. It has disrupted the flow of agricultural products. Prices have gone up, particularly poor families can't afford it. So we have to also take the long-term view and ensure that as we first priority, treat the sick and stop the infection. Secondly, that we rebuild and strengthen local health systems. But third, we've got to make sure that these fragile countries, these fragile societies who experience civil war, that Ebola does not so collapse their economies as to really risk that they would go back into a fragile state.
And while the burial team work is kind of a gruesome aspect of this, but it's also a critical one. The CDC estimates that 70% of Ebola cases come from contact with dead bodies, and so it's critically important to get the dead bodies removed and safely buried as quickly as possible.
There are areas where it's leveling off, but it remains uncontained, and it absolutely must be brought under control. It can be brought under control.
In many ways, part of the backbone of the Ebola response have been U.S. nonprofits operating very much on the front lines of dealing with this crisis.
The U.S. government and the people have really been, I believe, a game changer around raising awareness and support around this outbreak.
We've been involved in many prior responses to disasters, and I have never seen a more efficient, effective, responsive, coordinated response from the U.S. government in any prior crisis. This one has really been quite remarkable.
First of all, the U.S. military has done a heroic job. They have, because when they went in, there was a backlog of cases, and so people would sit for days and not even know if they had Ebola. When the U.S. military got there, that turnaround was done in just a few hours because they were able to clear the backlog.
There are Americans who are not only leading this effort, but who are in many ways the heroes that are making the containment of Ebola possible.
I think one clear message is if we as Americans want to ensure that our own country is Ebola free, the only way we will do that is by engaging on the ground in West Africa at the heart of this pandemic. The only way we'll do that is by ensuring that brave doctors, nurses, other teams are able to travel from American nonprofits to the heart of this pandemic to treat, to bury the dead, to provide community outreach. And ultimately, we've been asking Congress to support the President's request for $6 billion to deal with this pandemic as a bipartisan support, recognizing that we're looking at the safety of the American people, that we're trying to stop a pandemic, but as has been said, we're not just in this for the short term, but we want to take the steps to make sure that we do not find ourselves like this in a future situation because health systems haven't been built. If you know of someone or hear of someone who has dedicated their time and energy to go to the heart of this pandemic, support them, celebrate them, and recognizing that they are doing a service for you.
The media is just as important. How you all communicate about what's happening here, the truth of it, how to prevent it, what quarantine means, what monitoring means, what the conditions are for each of these is very important. Telling the story as it really is, I think, is vitally important from a media standpoint.
Facebook ran a campaign and featured several organizations. International Medical Corps was one of them, and it came at an important time because there was so much misinformation around Ebola, and also why it was, so important to stop it at its source. The message got through on social media. So I think that when people talk about it and when they share information about it, it becomes, I guess I would say, more easy for people to support it and less fearful when we view it through the lens of, if we don't stop it at the source, America and the rest of the world is at great risk and is catastrophic for those particular countries who have it.
We also work almost exclusively with locals. The head of our operation in Liberia is an expat. But our staff, as this thing really began to accelerate, no one walked off the job. No one said, I don't want to do this. In fact, they said, put me in again, put me in, keep me in. And I think it was really about pride of country and pride of almost nationalistic pride that made such a difference for us.
We are opening up training centers to support and to help other organizations that are sending staff into Liberia and Sierra Leone. What we are doing is we are offering to train them 7 to 10 days around case management protocols, things that we've learned over the last few months. We also are offering mobile support, and by the end of December, we will have a total of 4 treatment units, 2 in Sierra Leone, 2 in Liberia, 2 training centers, and as I mentioned, these mobile support teams. We just sent a team into Mali as a result of the recent outbreak as well.
The 350 communities where we had worked prior to Ebola, every one of them has been and remains Ebola-free. And it really tells you something about the importance of engaging at the community level. Yeah. And it's made it in those communities, in those counties, the surrounding communities, where we're known, it's made it much easier in dealing with the cultural traditions because people understand that and have a certain trust level, and so it's made it far easier. And today we're able to get 96% of bodies, dead bodies, removed within 24 hours, and I think that's been not the only factor, but an important factor in the much more positive trends that we've seen recently.
Support from the Office of Foreign Disaster Assistance at USAID. They are supporting a program where we can literally helicopter in patients to the treatment centers because we can't open up a treatment center where the patient is in every remote area. And we're also helicoptering in samples that need to be tested as well. So that's our short-term solution and until we have a better long-term solution.
Primarily in the burial teams, we have 47 burial teams that we manage. We have 32 disinfectant teams. We also have contact tracing teams, and we're engaged in community outreach and education and engagement.